evening. Welcome to APTN National News Weekend. I'm Daryl Stranger. Residents of Alberta, Saskatchewan, and Manitoba will no longer need to show proof of vaccinations to go to a movie or a pub or a restaurant. All three announced a plan to lift all COVID-19 restrictions. But some Indigenous communities in Alberta and Saskatchewan think it's too early to be lifting restrictions. Here's Tamara Pimentel to explain the situation in Alberta.
As COVID-related hospital admissions are declining.
Alberta's Premier Jason Kenney announced the vaccine passport is no longer necessary.
The program is no longer serving a useful and compelling purpose.
It's the first phase of a three-step plan to ease public health measures in the province that began at midnight last night. Children aged 12 and under will also be exempt from wearing masks in schools starting Monday.
It has also and always been the government's approach to keep public health measures in place only so long as they are absolutely necessary to protect public health and our healthcare system.
Kenney said Alberta passed the peak of Omicron infections weeks ago, and COVID-related hospital admissions are declining. But Dr. James Makokis from Saddle Lake Cree Nation says lifting these restrictions isn't such a great idea. He stated in an email, "I'm really worried for our people who have low double and triple vax rates, as well as low pediatric rates." And on the Blood Tribe, a representative told us that existing enhanced safety measures will be kept in place until further notice. When asked if the Premier's easing of COVID restrictions has any connection with the convoy blocking the Alberta-U.S. border,
none of that has to do anything with a few trucks parked at the Coots border crossing. All of it has to do with the fact that the disease is changing, and so the approach that we take to manage it should change as well.
Step 2 of phasing out public health measures will begin in March. Tamara Pimentel, APTN National News, Calgary.
Lifting proof of vaccination requirements in Saskatchewan is not going over well with Indigenous communities in that province. This week, the Federation of Sovereign Indigenous Nations urged band members to continue COVID protocols in spite of the government's decision. APTN's Leanne Sanders reports.
The Northern Intertribal Health Authority gives health advice to the chiefs of 33 First Nations in the far north. The authority's Dr. Namdi Dabuka says the government's timeline for lifting restrictions doesn't align with the reality on the ground and comes too soon.
We in public health, as well as our chief and council and other leaders, are quite concerned, particularly for two main reasons. Number one is that our COVID-19 vaccination coverage rate is not yet optimal, and we are lagging behind the provincial coverage. And secondly, traditionally we do have a lag in the Omicron wave. In the previous wave, first wave, second, third, and fourth, the North oftentimes lag behind by about 2 to 3 weeks. So it's our understanding that the Omicron wave, it's yet to peak in the north.
60% of those eligible in the authority's coverage area are fully vaccinated with 2 doses, but just 16% have their boosters. And communities have been hit hard in the pandemic. Dr. Dabuka says the government's lifting of some restrictions starting Monday puts a lot of pressure on those working on the front lines.
Actually, we do support that First Nation communities continue to implement measures that they deem appropriate to maintain safety within communities. But obviously, announcements like this really put a lot of pressure on us in terms of appropriately providing guidance in a way that the communities will remain safe.
Leanne Sanders, APTN National News, Saskatoon.
The Freedom Convoy protests continue across the country, and there are blockades at multiple Canada-U.S. border crossings. But many people are noticing the difference between how police are responding to these protests compared to Indigenous-led protests. We invited 2 guests to share their thoughts. Melissa Embarkey is a policy analyst with the Macdonald-Laurier Institute, an Ottawa-based think tank. Doug Cuthand is a longtime columnist at the Regina Leader-Post and Saskatoon Star-Phoenix. They joined Dennis Ward.
Thanks to you both for joining us. Doug, you wrote recently that this is a protest born out of white privilege, but there are a number of Indigenous people, including Melissa here, who are supportive. How do you see Indigenous support fitting into that narrative?
Well, I think we're not a monolithic group, and there's bound to be some support. I've seen lots of warrior flags, even the Haudenosaunee flag was showing there a few times. So, like I say, we're not a monolithic group, and there are people that are going to get involved, and that's their business as far as I'm concerned.
Melissa, some people say that the protest at its base is white supremacy. What do you think of that, and do you feel that's a fair comment?
I don't think it's a fair comment at all, because when you look at the demographic of truck drivers, it varies. We have a lot of, different groups that are part of this industry, including, my stepfather and my brother who are truckers. So I think that's a very unfair statement, and it's kind of stigmatizing why they're protesting. If all we're focused on is the color of their skin, we're not really looking at why they're there and, what they want to accomplish by being in Ottawa.
Let's talk about the police response to this compared to Indigenous-led protests, and it's become fairly undeniable that police are handling the convoy in a hands-off approach compared to, Idle No More, Wet'suwet'en. What's your view on this, Doug?
Well, I think that there definitely is a white supremacist trend running through this. They show the odd person of color in news, but basically it's a white man's protest, and it's they're the ones wanting this COVID mandate lifted. I don't see that in Indian country very much at all. In fact, in Saskatchewan, the premier is trying to lift the COVID mandate, and the chiefs are fighting back and saying, no, we're not going to lift it in our jurisdiction. In fact, just before this, I got off the phone, and two of my friends, one is in isolation and the other one has his mother in the hospital. So yes, this COVID is very, very a part of us, and it's premature to start talking about cutting back on the mask mandate and that sort of thing. It's still a very serious issue.
Melissa, your thoughts on the police reaction so far here to this convoy as opposed to Indigenous-led protests?
I think the police reaction, or any kind of reaction, it stems from what's happening in these protests. So if there's violence happening, they respond to that. If there is, something that's going on that's affecting other people and harming other people, then yes, police will take the proper response for that. So comparing the two protests and saying, well, they're not really acting on this one, but they did on another one, I think that's very unfair, because they act on threats that are happening. And in this last time around, we've seen 500 camp workers in BC locked in, not able to, move in and out of their camp, and the police came. So there is always, they always outweigh the threat and, what the possible outcome will be. And I also disagree, with Doug on these mandates. There are some communities in Saskatchewan who are highly vaccinated, like my reserve. I think we were at 90%, but we didn't get to 100%. There's other reserves that are at 40%, and there's a high number of communities where the vaccination rate is very low. So mandates and restrictions isn't going to, it's not going to change the fact that people aren't getting vaccinated. What's going to change is, bringing in proper measures, masks, personal protective equipment, home tests. These will all help communities and the people who are unvaccinated, and that's what our focus should be at this time.
Melissa, some would know that you're pretty prolific on Twitter. Your recent tweet seems to be asking protesters to change how they are behaving, though, staying off critical infrastructure. Do you think there's some anger building over time here in your observation?
There's definitely anger out there. I don't think highways should be blocked off for any reason. I don't think railways should be blocked off. I don't think protesters should be showing up at hospitals and schools. There's certain infrastructure where they absolutely should not be. And, if they want to protest, they've done what, we've been asking them before. They're at Parliament Hill. So right now they're an annoyance there, but they're not blocking critical infrastructure like a border crossing. And I think we need to address that now so that future protests, they follow the same rules as, previous ones. And I think saying some are getting off and some aren't, well, that's not the case, because we really haven't had the rule of law in any protests in the last 5 or so years.
Doug, these protests seem to be expanding. What do you think they reveal about the anger that might be simmering below the surface?
Well, I think there's the whole vaccine mandate and all that stuff. That ship has left. That's sailed. This is a right-wing protest now that wants to bring the government down, and they're going to do everything they can to inflict as much damage on the country as possible. And that's the real threat here. Look at how they're blockading the bridges and the border crossings and so on. It's doing serious damage to the country, to the working class people who they purport to represent. And well, they call for freedom. They're certainly not showing any freedom whatsoever in the way they're behaving. There's money in the United States and other places. This is an alt-right wing protest that's gotten out of control, and it has to end.
Doug, Melissa, we'll have to leave it there, but I appreciate you both taking some time to join us. Hope we can do it again.
Thank you.
Thank you.
We need to take a short break, but still to come, an update to an addiction story in BC we did in 2019. Welcome back. Many people across the country with addictions have been struggling for a long time. We brought you the story of Faith Alexis in 2019, more than 2 years ago. She was trying to survive the streets of Vancouver's downtown east side while fighting addictions. Now APTN's Tina House has an update and a warning: this story may be disturbing to some viewers.
Faith Rose Alexis was born on March the 8th, 1982 in Bella Coola, BC. Her mother, Mavis Benson, was just 16 years old at the time.
Being really young and naive, I just didn't know what I was in for, and after the labor I was just so exhausted, and she was a beautiful little baby, and I just totally fell in love with her when she was born.
Soon after Faith was born, Mavis became a single mom and moved back to their community, the Cheslada First Nation, near Burns Lake, BC. Faith's grandparents helped raise her while Mavis finished school. It was the stability in Faith's young life that she yearned for, and she thrived as she learned about her culture. Her mom says Faith wanted to become a movie star and a model. She was excited for her future. In 2002, she even attended the American Indian Film Festival in San Francisco, California, to pursue her goals. And then she wanted to go to Hawaii to see the world.
She was a beautiful girl. She was always energetic and full of life, and she just loved life. She used to do everything that she could. She was just excited for life every single day.
Nearly unrecognizable, we met Faith in 2019. She was then 38 years old and living in Vancouver's downtown east side since 2008. Severely addicted to drugs, she lives in a single-room occupancy room on Vancouver's East Hastings Street. Her mom, Mavis, says it all started when she got into pills and alcohol when she was about 16, when they moved to Vancouver. In her early 20s, she got sober and had 4 children. She left the father of her children because she claims he was abusive. She tried hard to raise her kids on her own, but Mavis says she suffered from postpartum depression. So, Mavis took custody of 3 of her grandkids, while the youngest was adopted. And then, Mavis says, Faith's world turned upside down when her beloved grandmother Mary passed away.
When her grandma passed away, her world was taken from her.
Mavis agreed to wear a GoPro camera for this story, and hours into her search, she finds Faith on East Hastings Street, outside of the SRO where she lives.
Hi, Faith.
Hi. Oh, Mom, is that you?
Yes.
Oh, hi, Mom.
Hi, baby.
Hi.
Faith says she has just returned from the hospital and claims that she was tested for COVID-19. However, she was discharged even though she has gaping open wounds on both her arms and hands.
How come they didn't even look at your arms and wrap your arms?
No, I know. But they didn't anyway. They discharged me. They told me they cough gets worse to come back.
You sound pretty bad.
Yeah.
Faith is just one of the thousands of people who are living in poverty, and down here, addiction is just a way of life. And back in 2019, she agreed to be filmed to show the reality of what it's like living in places like this. For Faith, years of addiction and not taking care of herself has resulted in poor health and a weak immune system, making her a perfect target for COVID-19. This is Faith's room. It's infested with bed bugs and cockroaches and piles of garbage and clothes. The shower is totally filled with clothes and debris, making it unusable.
Look at that. Oh my goodness.
Admittedly heavily addicted to drugs and dealing with mental illness, every day it's the same, finding drugs and doing drugs. 2 years after this story was filmed, we ran into Faith on East Hastings Street.
So,
do you want to get sober, Faith?
Yes, I do. Yes, I do. Yes, yes. Okay. Yeah.
Do you need help to do that?
Yes, I do. I need help to get into recovery. I need to go in first. I need to go into the hospital. I need to go into the hospital. I need to check in. I need to get my arms finished so they can get some healing. You know, I need to get some sobriety. I can't wait till the day I become sober and the day I don't deal with addictions anymore. Yeah.
What do you want other kids to know about the life down here?
It's really hard. Like, it's really brutally hard. Like, you can even see, like, the way people walk, and they're walking, and they've been down here for years and years and years and years and years. And you don't ever want to end up like that. You don't ever want to end up on a road where you're broke. You don't want to ever become a drug addict.
What do you want to say about your children?
I love them very much, and I miss them so dearly, and I can't wait to be home with them, and I can't wait to be sober.
Shortly after this interview, Faith was admitted to the hospital and is now awaiting treatment. Tina House, APTN National News, Vancouver.
Now, we just heard from Faith's family that she has been admitted to a treatment program, but just this week, the Coroners Service announced 2,224 people died from an overdose last year. That's an increase of 26% from 2020. APTN's Tina House joins us from Ground Zero in Vancouver's downtown east side.
We're here on Vancouver's downtown east side, which is literally ground zero for the opioid crisis here in BC. Joining me today is Trey Helton from the Overdose Prevention Society. Trey, can you tell me a little bit about the situation here on the streets, and has it improved at all?
It's not improving. The supply is dangerous right now. It's tainted. It's contaminated with benzos. We're seeing a lot of fentanyl right now, and it's just wreaking havoc. It's putting a huge strain on the healthcare system. It's putting a huge strain on us. We're running out of oxygen some days. Our tanks are always running low. We're effectively a daycare. People laid out along the side, and among other things, people are being assaulted, physically assaulted, sexually assaulted. They're having all their possessions robbed when they pass out on this benzo dope, and it's really horrific.
Are you seeing it like 9 times out of 10 cases we're seeing benzo in the drugs down here?
It's really 50-50. It's totally a gamble. You're gambling with your life.
Wow. Trey, you spent a number of years down here dealing with your addiction as well. Are you okay to talk with us about that time of your life?
Absolutely, yes.
Okay.
Yeah, I lived right there on the sidewalk in front of Insight at 139 East Hastings, flopping around like a fish for about 3 years. Using every day. It was a nightmare. It was a living nightmare.
What was it like for you, and how did you get sober?
I found a 12-step fellowship that works for me, but there's lots of other options for people. There's Smart Recovery, there's non-religious based ones, and just find what works for you.
BC's Chief Coroner is releasing a report today talking about the worst year on record for deaths. What would you like to say about that?
It's not going to stop. I see it continuing, and drastic measures have to be taken immediately. I don't like, all of our friends are dying, and we're having multiple memorials in one day. We had a day back in November where we had three memorials in one day. So we're losing a lot of good people, and it's really sad.
What can be done, Trey, to wrap this interview up today? What can be done to help the situation here and right across the country?
I'd like to see more safe injection sites, more safe inhalation sites, less stigma around using, easier access to detox and treatment, safe supply options for people who aren't ready to stop using, and If you are using drugs, don't use alone. Make sure that you have someone with you. The number one reason that people are dying in this crisis is due to using alone.
Trey Helton, thank you so much for your time today. Back to you in studio.
All right, we need to take one final break, but still ahead, an art center in the Yukon has commissioned a one-of-a-kind snow sculpture for an exhibit. Welcome back. An art center in the Yukon has commissioned a one-of-a-kind snow sculpture for an exhibit. And while it may not be obvious at first glance, a meaningful piece of First Nations artwork is the inspiration behind it. Here's Sarah Connors with that story.
It takes a lot of snow, chiseling, and shoveling to transform a 10-foot tall block of snow into a work of art. For the last few days, these snow carvers have been shaping snow into an eye-catching sculpture, a kraken's tentacles intertwined with a float plane. And there's First Nations meaning behind this piece.
It represents when we're taken and brought back by a float plane.
The sculpture was originally based on this float plane carving by Kaska artist Dennis Shorty, which is on display at the Yukon Arts Center. As a child, Shorty was flown by float plane from his community of Ross River to residential school in Lower Post in northern BC.
I put numbers on it in letters. I put LP for low post and 282, that's my name. Residential school, yeah. So that's what they're carving at.
Shorty says he struggled for many years with the trauma of residential school and his mother being murdered. He says the piece is a representation of struggle and perseverance.
Just to show people out there that you could persevere no matter what comes your way.
The snow sculpture was commissioned by the Yukon Arts Center and Whitehorse as part of the Yukon Permanent Art Collection's Collective Memory exhibit. Sculptor Michel Gignac was intrigued by the piece and chose it from the gallery to recreate, but he wanted to do something different.
That was kind of the initial, that would be so cool to do a float plane, and then how we can tie it in so that, because it's really hard to do flying planes. So how you can make a little bit of a story with the float plane.
Gignac says it's up to the viewer to interpret the message.
I guess it's just to create more story, kind of more for people to read into.
Teslin Tlingit artist Ken Anderson is assisting with the sculpture. He says hopefully it will inspire people viewing the exhibit to learn more about First Nations history.
Obviously that school down in Lower Post is gone now, but it's kind of about the memory, right? Kind of like this piece, it'll be gone. It won't last too long, but it's like that. But it was still here, So the memories are still there, right?
I would like to see it. We know those two too. So.
Shorty says he plans on traveling to Whitehorse to see the sculpture next week. Sarah Connors, APTN National News, Whitehorse.
That's all we have for you tonight. I'm Daryl Stranger. Thank you so much for joining us, and have a great weekend.